Welcome to my channel. In this video we are going to learn about blood supply of long bone. The long bone is supplied by following four set of arteries: nutrient artery, periosteal arteries, metaphyseal arteries, epiphyseal arteries. Nutrient artery, it enters the middle of the shaft through nutrient foramen. It then passes obliquely through the cortex, and in the medullary cavity it divides into ascending and descending branches. It enters the middle of the shaft through nutrient foramen. It runs obliquely through cortex and then divides into ascending and descending branches within the medullary cavity. Each branch then divides into small parallel channels which terminate in metaphysis by anastomosing with epiphyseal, metaphyseal and periosteal arteries. Each branch divides into number of small parallel vessels which terminate in metaphysis by anastomosing with metaphyseal, periosteal and epiphyseal arteries. These form hairpin loops in the metaphysis. Therefore, metaphysis is most vascular zone of the long bone. Nutrient artery supplies medullary cavity, inner two-thirds of cortex and metaphysis. Nutrient artery supplies metaphysis, medullary cavity and inner two-thirds of the cortex. Periosteal arteries. They are numerous. They ramify beneath the periosteum. They supply outer one-third of the cortex. Periosteal arteries are numerous. They ramify beneath the periosteum. They supply outer one-third of the cortex. Metaphyseal arteries, also known as juxtaepiphyseal arteries. They are derived from neighboring arteries. They enter the metaphysis directly along the attachment of joint capsule. They are derived from neighboring arteries. They enter metaphysis directly along the attachment of joint capsule. Epiphyseal arteries, they are derived from arterial anastomosis around the joint. They enter epiphysis either directly or by piercing through epiphyseal cartilage. Let us now revise blood supply. Long bone is supplied by four arteries. Nutrient artery, it enters the middle of the shaft through nutrient foramen. It runs obliquely through the cortex and then divides into ascending and descending branches. Each branch then subdivides into numerous small parallel vessels. These vessels anastomose with metaphyseal, epiphyseal and periosteal arteries and terminate in the metaphysis, forming hairpin loops. Metaphysis, most vascular zone of the bone. Periosteal arteries, they are numerous. They ramify beneath the periosteum. They enter the Volkmann's canal and supply outer one-third of cortex. Metaphyseal arteries, they are derived from neighboring arteries. They enter the metaphysis directly along the attachment of joint capsule. Epiphyseal artery, they are derived from arterial anastomosis around the joint. They supply epiphysis directly or after piercing the epiphyseal cartilage.